Depression can have a significant impact on the brain, and its effects can be both structural and functional. Here are some ways depression can affect the brain. 1. Changes in brain structure. Studies have shown that people with depression have smaller hippocampi, a brain region involved in memory and emotion regulation. They also have less gray matter in the prefrontal cortex, a region involved in decision-making and problem-solving. 2. Alterations in neurotransmitters. Depression is associated with changes in the levels of neurotransmitters such as serotonin, norepinephrine, and dopamine. These chemicals play a role in regulating mood, motivation, and pleasure. 3. Abnormal activity in brain regions. People with depression may have abnormal activity in certain brain regions, such as the amygdala, which is involved in the processing of emotions, and the anterior cingulate cortex, which is involved in cognitive control and decision-making. 4. Impaired neuroplasticity. Neuroplasticity refers to the brain's ability to change and adapt in response to experience. Depression has been linked to impaired neuroplasticity, which may contribute to the persistence of negative thoughts and emotions. 5. Cognitive dysfunction. Depression can affect cognitive processes such as attention, memory, and executive function, which can make it difficult to concentrate, make decisions, and perform daily tasks. 6. Inflammation. Chronic inflammation has been linked to depression, and studies have shown that people with depression have higher levels of inflammatory markers in their blood and cerebrospinal fluid. Inflammation can affect brain function by disrupting neurotransmitter balance, impairing neuroplasticity, and contributing to oxidative stress. 7. Sleep disturbances. People with depression often experience sleep disturbances, such as difficulty falling asleep, waking up frequently during the night, or waking up too early. Sleep is important for brain health, and disruptions to the sleep-wake cycle can affect cognitive function, mood, and emotional regulation. 8. Stress response. Chronic stress can contribute to the development of depression and can also affect brain function. The stress response involves the release of hormones such as cortisol and adrenaline, which can have negative effects on the brain, including impaired neuroplasticity and increased inflammation. 9. Genetics. There is evidence that genetics can play a role in the development of depression, and some studies have identified specific genes that may be involved. Changes in gene expression can affect neurotransmitter balance, neuroplasticity, and other brain functions. It's worth noting that depression is a complex and multifaceted disorder, and its effects on the brain can be influenced by a variety of factors, including genetics, environment, and individual differences. The good news is that there are effective treatments available for depression, including psychotherapy and medications, which can help to alleviate symptoms.